Hi everyone, it's Dr. Dave, and today on Dr. Dave's 411, we are going to try and answer a few questions I get asked all the time. In fact, we will cover everything from reversing heart disease with diet to exercising monkeys. Seriously, we are going to talk about exercising monkeys. Okay, here we go. Question number 1. Dr. Dave, can coronary artery disease, cholesterol buildup in the heart, be reversed with diet? Yes, coronary artery disease can be reversed with diet. In fact, a study called the Lifestyle Heart Trial by Dr. Dean Ornish enrolled patients with coronary artery disease to a low saturated fat vegetarian diet along with stress management and exercise, and compared them to a group who ate a traditional American diet. Initially, these patients had a catheter inserted into the arteries in their heart to measure the amount of plaque or cholesterol buildup at baseline. Then again in 1 year and 5 years later, after following the diet and lifestyle recommendations. Most of the people in the vegetarian group had regression or reversal of plaque, whereas the control or non-vegetarian group had progression and more than twice as many heart problems such as heart attacks.
What the hell?
Question number 2. Dr. Dave, is it possible to reduce cholesterol buildup in the heart with exercise? Yes, exercise can reduce cholesterol plaques. One study looked at monkeys which were fed an atherogenic diet, meaning a diet high in saturated fats, and then divided them into 2 groups. One group exercised on a treadmill and the other group did not. The monkeys were sacrificed, and it was noted that the monkeys who exercised had less cholesterol buildup and even larger arteries when compared to monkeys that did not exercise. So exercise can be a very important part of reversing heart disease.
My eye!
Final question. Dr. Dave, isn't it true that low-fat diets are better than high-fat diets? This is false. Low-fat diets are not necessarily better than high-fat diets. The problem is, when we follow a low-fat diet, we often replace the fats with refined carbohydrates. In fact, decreasing total fats in a diet is not necessarily better, but rather decreasing saturated fats and trans fats are what matters. Saturated fats will increase LDL levels in the blood, which can promote atherosclerosis. The most common source of saturated fats in the American diet? Cheese, primarily from pizza. Other sources are red meat and dairy products. If we replace saturated fats with heart-healthy monounsaturated fats like olive oil, nuts, avocados, and polyunsaturated fats like walnuts and flaxseed, then we can consume fats and still live a healthy lifestyle and have a healthy diet. This is best demonstrated by some Mediterranean diets, which may consist of up to 40% of healthy fats and have been shown to decrease the chance of experiencing a heart problem, heart attack, death by up to 30%. Okay, so those are the questions for today. One quick joke before I go. Why shouldn't you date a pastry chef? Because they will desert you.
What? Nothing.
Desert you. Did you hear about the human clock? He went back for seconds. Okay guys, I'll stick with cardiology. Until next time, this is Dr. Dave.